Thanks, James.
I'm going to dip into the CDC meeting for just a minute, Nick, as they're just discussing
COVID vaccines,
COVID
right?
vaccines.
A big topic. Let's take a listen into what's happening right now.
Determine rates. If there's a signal that's picked up in VAERS, then my understanding is that then people look more specifically, for example, in VSD to see if there is a correlation. But the vast majority of reports that are made to VAERS by either the vaccinee, the parents, the pharmaceutical company, have nothing to do with the vaccine. But we are taught to report that regardless, in case there might be something that's unanticipated. So I think people need to realize that the overwhelming number of reports to VAERS are unrelated to administration of a vaccine. Now, the question that I would like to ask Dr. Meyer, and thank you for the very interesting data. That's the first time I've seen it, that the rate of myocarditis was 38 per 1 million. And I think if I remember correctly, you said that the current rate is 2 cases per million. So that's probably, I would guess, the background rate of myocarditis in this population, which I think is very reassuring. But the question I have for you is relates to the long-term follow-up of myocarditis. As you pointed out, there have been studies that have reported on gadolinium-enhanced MRIs that have indicated scarring in the myocardium. And even though the vaccinee feels fine and is doing well, the concern is that may predispose to cardiac arrhythmias and death later on in life. So the question I have is, and I think the vaccine.
You're watching Live Impact News on WCNC Plus. I'm Nick Sertivant. We are about a minute past the top of the hour, 101. You're watching live as CDC Vaccine Advisory Panel. They talk about the COVID-19 vaccine and recommendations there. A big topic there as far as vaccines, COVID vaccines. So we'll get back to that as soon as we can. We want to shift now to